According to the American Cancer Society, colorectal cancer is the 5th prevalent cancer in Idaho and the 2nd highest cause of death. St. Alphonsus colorectal cancer surgeon Dr. Dattani explains more about this illness. Dr. Dattani, so good to see you, and we're going to talk about a very important topic once again. This is colon cancer. So first of all, help us understand the risks of colon cancer, and then what are the symptoms?
Roughly 80% of colon cancers are sporadic, which means it's just bad luck. There are other risk factors such as obesity and sedentary lifestyle, processed foods and foods that are low in fiber, as well as red meat. Smoking is also a risk factor. A positive family history, we do see about 20% of genetic causes, so perhaps someone in the family may have a history of colorectal cancer, as well as age over 50. As far as the symptoms of colorectal cancer, generally there's no symptoms at all. That's why we encourage getting screening done. Change in bowel habits, rectal bleeding, iron deficiency anemia, and abdominal pain are some of the symptoms a patient may have.
Okay, and is there a way that we can prevent colon cancer, or at least things that we can do to help minimize our risk?
The best thing someone can do is talk to their primary care provider about screening. Right now, colonoscopy remains the gold standard for screening. Screening begins at age 45. Other things you can do is just like any other medical condition is making sure you're living a healthy lifestyle, making good choices in regards to what you eat, staying physically fit, quitting smoking if you do smoke, and limiting alcohol intake.
If someone is diagnosed with colon cancer, help them understand what would this treatment look like?
As far as colon cancer, generally surgery is offered up front, followed by, depending on the final stage, sometimes chemotherapy, which is delivered as a pill over a period of a few months. Rectal cancer is slightly more aggressive, generally is treated with chemotherapy and radiation first, followed by surgery.
And Dr. Dattani, help us understand what makes the colon care at St. Alphonsus so unique.
So we're very fortunate to have state-of-the-art equipment, such as the Da Vinci Xi robotic system, which allows me to do major abdominal surgery through just a few small incisions. Generally, these patients would be going home in 7 to 10 days, but with these small incisions and with access to this Da Vinci system, patients are generally going home in a few days after surgery. They're up and walking the same day of surgery. They're eating the same day of surgery. We find that the outcomes are much better. We also have a collaboration with Oregon Health and Science University in Portland, Oregon. Sometimes we get very complex cases, and we have the ability to talk to Oregon Health and Science University about finding the best routes of care for these patients.
And where can our viewers go to learn more?
You can go to santalphonsus.org.